We're really excited today. We have Dr. Perepezko here with us to talk about some of the wellness that comes with the diagnosis. Kate Perepezko, PhD, MSPH, is a postdoctoral associate with the National Rehabilitation Research and Training Center on Family Support at the University of Pittsburgh. She completed her PhD in mental health and her MSPH in social and behavioral interventions at the Johns Hopkins Bloomberg School of Public Health. She has spent the last 8 years working with the Parkinson's disease population and focused her dissertation work on better understanding the role of the caregiver in the quality of life of people with Parkinson's disease. She hopes to continue working to improve quality of life for both caregivers of people with PD and their care recipients. Dr. Perepezko, thank you so much for being here today.
Thank you all for joining, and thanks for having me. I think I'll share my slides now unless we want to wait a little longer. Good to go. Okay.
Get started.
Yeah.
This will also be offered, and Dr. Perepezko has graciously agreed to let us have her slides, so that will be posted as well tomorrow along with this program.
Yep. Okay, great. Can everyone see the slides okay? Okay, perfect. So like Eden mentioned, my name is Kate Perepezko, and I'm currently a postdoc at the University of Pittsburgh in the very long named center, the National Rehabilitation Research and Training Center on Family Support. And today I'll be presenting on Parkinson's fundamentals with a focus on mental health and wellness. And Eden gave a really good overview of my background, but just to give you a little more information, prior to starting my current position, I worked for about 5 years as a research coordinator with Dr. Greg Pontone at the Johns Hopkins School of Medicine in the Department of Psychiatry. And it was in this position that I was first introduced to Parkinson's disease and research in this field. And I contributed to several studies investigating mental health for PD with a focus on anxiety, mild cognitive impairment, and psychosis. After that, I began my doctoral program in mental health and conducted my dissertation work trying to better understand factors that impact quality of life for people with PD. And I'll share some of that work with you later on today. And then in my current position, I'm really trying to gain more of a research background in caregiving research. And I hope in the future to develop and implement interventions that can improve quality of life for both people with Parkinson's as well as their care partners. So here's an overview of what I hope that we can cover today. There is a lot of content and I will be sharing these slides. So I hope that you can just kind of listen, take notes if you need to, but we'll definitely have time for questions at the end. I really hope that after today's session, you can all become more familiar with how mental health can be impacted for people with Parkinson's. I want to provide you with ways that you can recognize the signs and symptoms of different mental health conditions in PD, so that you can bring these signs and symptoms to your clinicians and receive adequate treatment. I'll also review some of the best evidence treatments that currently exist for these different conditions. And then at the end of the session, I want to present some general wellness guidelines that are really beneficial for everyone, but particularly for people with Parkinson's. And before we move forward, I want to remind everyone that what I present today are possible, but not definite symptoms and experiences you may have. So these happen for some people with PD, but not everyone. I also want to acknowledge that dealing with a new diagnosis is challenging for anyone. This diagnosis can lead you to experience a range of emotions and reactions like loss and grief for what might be at risk with this new condition. You may experience changes to your body image and self-concept. You may perceive some uncertainty about your treatment, prognosis, and any changes that may happen with your relationships. And these can all contribute to a decrease in your quality of life. So I think this makes, when you're newly diagnosed, as well as throughout the disease, it really important for you to seek out resources so that you can learn more about Parkinson's and move forward proactively, which you're all already doing by attending these sessions that are offered through the PMD Alliance. Great, so next I'm going to give you an overview of some areas of mental health that can be affected for people with Parkinson's. As you may know, historically, Parkinson's treatment and still the diagnosis is focused on motor symptoms. But within the last decade or so, there's been more attention paid to non-motor symptoms and mental health symptoms specifically. This shift in research and in practice is really important because mental health is actually the factor that has the greatest impact on quality of life. And there's also substantial evidence to support that addressing different mental health conditions in PD can have the biggest improvement on your overall quality of life, as well as your overall functioning. So in the next several slides, I'll present some information on each of the mental health conditions that I have included in this figure here. I want to describe what the conditions involve, how common they are for people with PD. I'll share some risk factors for the conditions. And then I also want to share some guidance for how you, as well as your family and friends, may be able to recognize these different conditions. So to start, we'll cover depression. And while everyone feels sad from time to time, and especially people who are receiving a new diagnosis of a chronic condition like PD may experience grief, depression is something different. So unlike sadness that's more temporary, depression usually lasts for weeks or even longer. And there's actually evidence that suggests depression is part of the Parkinson's disease process itself and relates to changes in brain chemistry that occur in PD. Up to 50% of people with Parkinson's disease will experience some form of depression during their disease course. It tends to be worse for individuals who have more severe motor symptoms, as well as those who experience severe cognitive impairment. And I want to draw your attention to this graph I have on the right side of the slide, which shows the timing of the first depression symptoms at different stages of the disease, including before a diagnosis is received. So you can kind of see there's an uptick in depression episodes following a Parkinson's diagnosis, but there are people who can be diagnosed or experience depression throughout the disease course, including before a diagnosis. As we'll hear for all of the conditions I described today, there's no one cause of depression, but instead there's several factors that can contribute to depression that are characterized as psychological, biological, and environmental. So people can experience negative thoughts about living with a chronic illness, and this can lead to feelings of sadness, helplessness, and hopelessness. Social isolation can also result from living in a more restricted lifestyle and increase your risk of having depression. And then, as we saw in the graph on the previous slide, research suggests that the PD experience includes depression sometimes. So people can experience depression 2 to 5 years before they're diagnosed with PD. And both conditions of Parkinson's disease and depression can impact different brain chemicals or neurotransmitters like dopamine, serotonin, and norepinephrine. And these all influence both your mood and your movement. And lastly, environmental factors like severe stress, as well as some medications and their side effects can either mimic or induce depression. So how do you know when what you're feeling is going beyond normal sadness and becomes a depressive disorder? The symptoms of depression in Parkinson's are very similar to depression in the general population. So to receive a diagnosis of depression, a person must experience a depressed mood or a loss of interest or pleasure in daily activities, most of the time for at least 2 weeks. They also must experience some of these additional symptoms listed here, so changes in sleep, decreased concentration or attention, increased fatigue, feeling slowed down or restless, feeling worthless and guilty, or having suicidal thoughts or wish for death. So I want to make note that you don't experience all of these symptoms to have depression, but some combination. And then in Parkinson's disease specifically, people with depression more frequently report dissatisfaction with life, irritability, pessimism, and suicidal thoughts. However, suicide completion is actually lower in PD. And then I want to point out that most people who are diagnosed with a serious illness will feel grief and hopelessness at some point, but clinical depression is a distinct condition, and there are several treatment options that I'll describe later on. And before we get to the next mental health condition, I want to describe some of the challenges with depression that are specific to Parkinson's disease. Depression in this population can be hard to recognize because certain symptoms of depression actually overlap with those of Parkinson's disease. For example, people can experience sleep problems and feeling slowed down in both conditions. Hypophonia or a soft voice can also be present in both conditions. And facial masking, which is a symptom that can make it difficult for you to recognize any emotion that's expressed in a person with PD, can also make it more challenging to recognize depression. So I think these points really all indicate the need for other people around you to maybe help you with identifying any mood changes. And you also need to advocate for yourself if you're noticing different changes in how you are approaching your normal activities or things that you once enjoyed. Next, I'll give some information about anxiety. So anxiety is a feeling of nervousness, worry, or unease about what could happen, and it can lead to very real physical symptoms as well. So some people report having shortness of breath, a racing heart, sweating, or other things like that when they're experiencing anxiety. Anxiety is not in itself a disorder, and we all will experience anxiety as a normal part of life. But most anxiety resolves over time. So if there's anxiety that's more severe and persists for a long period, so much so that it interferes with daily activities, that's when it's generally considered a disorder. And there are several treatments that can help address these symptoms. Up to 55% of people with Parkinson's will experience clinically significant anxiety symptoms at some point over the course of the disease. And 31% of people with PD have an anxiety disorder, which I'll describe some of the different disorders on the next slide. But before we move on, I did want to draw your attention to this graph, which is similar to the one we saw for depression. So this shows the first episode of anxiety along the course of a person's life, including diagnosis with Parkinson's. So here you can see that anxiety does not seem to be as tied to disease severity, and many people can experience anxiety well before they're diagnosed with Parkinson's disease. So on this table, I have a breakdown of the different types of anxiety disorders that can occur in Parkinson's, as well as the general population. I also have listed some of the symptoms that are common and the frequency of these disorders in the Parkinson's population specifically. So generalized anxiety is characterized by feelings of nervousness and recurring thoughts of worry and fear. This worrying is more than you would normally expect for any given situation, and it often leaves a person feeling out of control. There's also some physical symptoms that can accompany generalized anxiety, like butterflies in your stomach or nausea and trouble breathing, among other types of physical symptoms. Panic disorder is another type of anxiety disorder that some people call panic attacks. And these usually start very suddenly, and you'll experience a severe sense of physical and emotional distress. So many people who experience panic disorders describe it as almost like a heart attack. They feel like they can't breathe, and it comes on very quickly. These episodes usually last a few minutes. Sometimes they can last an hour or more. And in Parkinson's, they're particularly associated with off periods. So periods when you feel like your medication is starting to wear off or not work as well, or if you're getting towards the end of your dose. Another category of anxiety disorder is social phobia, which involves avoiding everyday social situations. So people with a social phobia experience extreme anxiety when they're in social situations, and this anxiety generally goes away when they remove themselves from those situations, but it can cause avoidant behaviors. Specific phobia is an intense and irrational fear about something that does not actually pose danger or poses little danger. And then this last category, anxiety not otherwise specified, captures other anxiety types that don't really meet the diagnostic criteria for these other disorders, but it's anxiety that still interferes with your daily functioning. So for people with PD, this is most commonly associated with anxiety that's related to on-off fluctuations, but is not meeting criteria for a panic disorder. And as with depression, there's no one cause of anxiety, but several factors that can contribute to or increase your risk for anxiety. So common fears and worries about the general life or that go along specifically with PD can trigger anxiety. Another concern is being embarrassed, often related to interacting with others in public, which can contribute to social isolation and worsen anxiety. And some biological factors like changes in levels of different neurotransmitters and off periods can also contribute to anxiety. Additionally, while some people with PD will experience anxiety on its own, many are diagnosed with anxiety and depression together. So these are both things that can be addressed with treatment, but it's worth noting that they might co-occur. Anxiety is usually diagnosed by a primary care physician or a mental health professional who will ask you some questions about certain symptoms you may experience and any changes you've noticed for your mood or different behaviors. An anxiety disorder diagnosis is made for people with PD only if the signs are not easily confused with any movement symptoms. And there also must be a clear change in a person's previous behavior. Some of the symptoms that contribute to a diagnosis are listed here. So there's difficulty concentrating, muscle tension, sleep problems, increased heart rate, changes in blood pressure, increased sweating, and hot and cold flashes. And then I just put a tip here on the side for everyone. I think people who might be concerned with anxiety, it can be helpful to take notes about your symptoms and the timing of your symptoms, because that can help to inform your different treatment options if you think your anxiety may be related to on and off fluctuations. Next, we'll talk about apathy. So apathy describes a lack of interest, enthusiasm, or motivation. And up to a third of people with Parkinson's disease will experience apathy at some point. This can be either a brief episode or long-lasting. And as a consequence of apathy, many people, it can interfere with the effective management of Parkinson's disease symptoms, unfortunately, because people with apathy might be less inclined to take their medication regularly and exercise, which are both really important for managing your symptoms. The symptom is likely due to a lack of dopamine that results from Parkinson's disease changes to your brain. And it can impact anyone at any time in their disease course, but people who have depression, anxiety, or impaired cognition are found to be more susceptible to apathy. There have also been studies that show that older age and more severe motor symptoms can put people at higher risk for apathy as well. And apathy is usually detected with some of these questions I've listed here. You may be experiencing apathy if you feel that it is increasingly hard to get up and participate in normal activities or activities you usually enjoy. It can be especially challenging because people with apathy usually don't realize there's a problem. So this is another mental health condition where friends and family might notice behavior and personality changes before you do. But it's really important to bring these concerns to your clinician because they can do some tests to figure out if symptoms are due to apathy or if they might be due to depression or some other type of medical condition. And I also want to point out that apathy is a symptom of the disease. So it's important to remember that people with Parkinson's who have apathy aren't being lazy or making excuses. And there are definitely different ways that you can manage apathy and hopefully address some of these consequences. Next, we'll talk about psychosis. Psychosis occurs in between 20 to 40% of people with PD, and it's experienced as illusions, hallucinations, or delusions. So those are different types of psychosis. Illusions are the most minor form of psychosis, and these are defined as sensory misperception. So an example of an illusion is someone may be seeing clothes in the closet and thinking they look like a group of people. Next is hallucinations. So this is when someone sees, hears, feels, tastes, or touches something that isn't really there. And this happens when a person is awake, so they're completely different from dreams or nightmares. But hallucinations can occur at any time of the day or at night. And then delusions are illogical, irrational, dysfunctional views or persistent thoughts that are not based in reality. So this is on the more severe side of psychosis, and people who experience delusions are not doing it deliberately, and the delusions they have are very real to them. So it's hard to talk someone out of a delusion. There are three main contributors to the development of psychosis in Parkinson's disease, and these include medications, dementia, and delirium. So unfortunately, the classic PD medications like carbidopa, levodopa, and dopamine agonists that are used to improve motor symptoms by increasing dopamine levels can also contribute to psychosis and other behavioral changes. There are also other medications that are often used to treat PD that can cause psychosis symptoms by lowering levels of acetylcholine and shifting the balance with dopamine. So I listed some of them on this slide. Amantadine is one, and then anticholinergics, which can be found in some prescription drugs, but are also found in over-the-counter sleep aids, and many allergy medicines can induce some psychosis symptoms in some people. So I think this really makes it important for people to try to keep an up-to-date list of your medications. So if you are experiencing any of these symptoms, you can share your medication list with your provider. And then dementia is also linked to psychosis. So people with dementia are at higher risk for experiencing psychosis. This usually does not happen in the early stages of Parkinson's disease. And in fact, if someone is experiencing dementia and psychosis early on, a clinician may consider a diagnosis of Lewy body dementia rather than PD. And then the last factor that can cause psychosis is delirium, which is an altered state of consciousness or confusion. And this is actually reversible. So delirium usually develops over a really short period of time, and it can resolve after you address the underlying condition that causes the delirium. So I listed some of the common causes of delirium on this slide. These include infection, an imbalance of electrolytes, some other disease, and a vitamin B deficiency. So usually with looking at psychosis, once the probable cause of the psychosis is determined, a treatment plan can begin. The diagnosis of psychosis usually occurs after someone experiences either illusions, hallucinations, or delusions that occur for at least a month. And for it to be considered a PD psychosis, these symptoms must occur after you're diagnosed with Parkinson's disease. And generally, clinicians will also try to rule out any other causes of psychosis like depression or delirium before making a PD psychosis diagnosis. So the last type of mental health condition or change that I'll discuss today is cognitive changes. There are some changes that can occur in different cognitive domains that I have depicted in this picture. So things like memory, attention, language, your visual spatial perception, and executive functioning. You may experience changes in these areas. Generally, this starts off as a mild cognitive impairment, which might not even interfere with your normal functioning. And about 50% of people with Parkinson's disease will experience some type of cognitive impairment, but not all of these cases will go on to a diagnosis of dementia. As with most mental health conditions, the exact cause of cognitive impairment or dementia in Parkinson's is not fully understood. Currently, researchers are working out exactly why and how PD causes thinking and memory problems. And I've presented some of the factors they think contribute to these cognitive changes on this slide. So they believe that both changes to brain chemicals, so those neurotransmitters, as well as brain cells may play a role. So neurotransmitters like dopamine, acetylcholine, serotonin, and norepinephrine are all important for cognition and can be affected by PD. In addition, brain cells that are responsible for cognition can be affected by the protein alpha-synuclein if it misfolds and clumps into clusters, because this can contribute to cell damage or death and lead to some cognitive impairment. And as we described in the earlier section, delirium can also contribute to a more immediate but reversible cognitive change. And on this slide, I wanted to present some of the different ways that you might notice changes to these different cognitive domains. I apologize, it's a lot of information, but I think this is helpful to consider for the future. So if you experience any changes with your attention, you may notice difficulty in completing complex tasks or shifting your attention. You could also have problems with concentrating during a task. If you have any changes in your mental processing, you may notice delays in your response to different stimuli or during conversations. And you may take longer to complete tasks. For executive function, you may notice problems with planning and completing activities. And you may also experience difficulties in more abstract level thinking. For memory, you may experience difficulty with common tasks like making coffee or balancing a checkbook. And for language, you may have issues with word finding, which some of you may recognize as the tip of the tongue phenomenon. You might experience difficulty with language, especially if you're under pressure or experiencing stress. And you may have problems with naming objects. And then the last cognitive domain is the visual spatial perception. So people with PD can experience difficulty with measuring distance or depth perception. So again, I want to emphasize you won't experience changes necessarily in all of these different domains, but I think it's just important to be aware so that you might be able to look out for any changes in the future. Great, so now that we have a better overview and sense of how mental health can be impacted for people with Parkinson's, I wanted to get into some of the specific treatment options that are currently available and recommended for people with these different symptoms. So I also want to comment on the mental health support team that you can use to help identify and treat these different conditions that we've heard about so far. A neurologist is someone who helps with the diagnosis and treatment of PD, but they can also help with connecting you to mental health support. And if possible, some of you may have a movement disorder specialist who's a neurologist with some extra training in movement disorders like Parkinson's disease. And they may be more familiar with the different psychiatric aspects of the disease as well. Your primary care provider manages your overall health, and they can also provide you with mental health screenings, as well as referrals to specialists. Social workers can help you and your family sort out and resolve issues that are associated with the demands of Parkinson's, but also life in general. So things like insurance, disability, family conflict, and other issues that might arise. And then there are licensed clinical social workers, licensed professional counselors, and psychologists who can provide you with psychotherapy. And many of these individuals specialize in one type of mental condition or other things like relationship issues. There's also neuropsychologists who have additional expertise in how behavior and cognitive skills are related to brain structure and symptoms. They can provide you with testing to determine if you have any cognitive or behavioral changes. Psychiatrists are medical doctors who can prescribe medications, and they specialize in the diagnosis and treatment of mental, behavioral, or emotional problems. There are also neuropsychiatrists. So these are psychiatrists with additional training in mental health issues for people with disorders of the nervous system like Parkinson's disease. So similar to movement disorder specialists, they just have that extra training that may make them able to recognize these issues easier. There's also occupational therapists who are trained to provide services to support your mental and physical health and wellness. They can help you learn different coping strategies and also create different routines to help you maintain your health. And then the last part of your team is your social network. So those are your family and friends who are really critical for your mental health. And as we've seen so far, they can help you recognize some of the changes in your personality and behavior that might be able to inform different treatment options. So first, I want to describe different treatment options for depression. Psychotherapy or talk therapy is one of the most effective types of treatment for depression. So in psychotherapy, a therapist will help you focus your attention and resolve some of the issues that concern you. One type of psychotherapy that is especially beneficial for depression is cognitive behavioral therapy, or CBT. And this helps people change some negative thought patterns and behaviors. There are also several types of medications that can help in treating depression. One type is selective serotonin reuptake inhibitors, or SSRIs, that can be effective for some people. But I do want to emphasize that there's no one medication that will work for everyone. So it really depends on other medications you might be taking, as well as any side effects you might experience. And those factors will determine what medication works best for you. So it's critical for you to work with your healthcare team to determine which treatment options are best. And it's also worth noting that therapy and medication together are actually more effective for resolving depression than medication alone. Another type of treatment is electroconvulsive therapy, which is a standard treatment for people who have very severe depression or depression that's non-responsive to medication or psychotherapy. There's also some lifestyle changes, like increasing your exercise, social activities, improving your diet, and these can all help with managing depression symptoms or even preventing depression. And lastly, there are some complementary therapies that can help with depressive symptoms. So things like light therapy, massage therapy, acupuncture, meditation, and music therapy have all demonstrated some effectiveness. And on the right side of this slide, I included some guidelines to help you with preventing depression or getting treatment for depression if you are recognizing some symptoms. So it's important to get screened for depression at least annually, which many of you may already be doing during your normal healthcare visits. It's important to discuss any mood changes with your doctor. And if possible, it can be helpful to bring a family member to your appointments with you, because this can help with the discussion of depression symptoms. And I wanted to also share a really hopeful note. Successful treatment of depression is one of the most significant ways to decrease disability and improve quality of life for people with Parkinson's disease. So that just really emphasizes the importance of getting help when you need it. There are also several effective anxiety treatments. So these include medications. So similar to depression, SSRIs can be used to treat anxiety as well as benzodiazepines, which can address anxiety symptoms and take effect very quickly, although they need to be taken with caution. Psychotherapy can also be helpful for people who have been diagnosed with anxiety, because they can be given tools to better manage their symptoms. And like depression, anxiety also benefits from different complementary therapies like relaxation techniques, music therapy, aromatherapy, and meditation. For apathy treatment, generally lifestyle adjustments are recommended. So things like creating a schedule that incorporates physical, social, and cognitive activities can be really important for people experiencing apathy. It can also be helpful to set some personal goals, and you might want to start with a goal that's easier to achieve and that you feel confident you can achieve. And then as you reach these smaller goals, you can set and accomplish bigger goals. Exercise is probably the last thing that someone who's experiencing apathy or feeling unmotivated wants to do, but it's very effective for helping people with apathy and addressing those symptoms. So something you might try if you aren't feeling motivated to do individual exercise is look for some group exercise classes. And there are many that are offered for people who have Parkinson's disease. Maybe people can share any exercise classes they've joined. I know there's boxing and yoga and dance that many people enjoy. There are limited medication options for treating apathy, but sometimes increasing your normal Parkinson's medications can be beneficial. But of course, this needs to be done very carefully and with close consultation of your doctor. And it really works best, again, with any of these behavioral modifications that we've discussed. So for treating Parkinson's disease psychosis, this really involves a multi-step process. So generally, a clinician will perform an evaluation of your symptoms and take into consideration your previous history, your disease stage, as well as your available support systems. They might determine that your psychosis is triggered by delirium, so they can address the cause of the delirium. But if the psychosis does not go away or is not caused by delirium, they may need to adjust some of your PD medications and refer you to counseling. And then kind of the next stage, if reducing or adjusting your existing medications doesn't work, further intervention is needed, and your doctor may initiate an antipsychotic therapy to help try to rebalance some of the chemical levels in your brain and prevent or stop those hallucinations, illusions, or delusions from occurring. And I want to put caution here because many antipsychotic medications that are used in the general population can actually worsen motor symptoms for people who are living with Parkinson's disease and should not be prescribed in this population. And I gave an example here, Haldol, which is most commonly used in the hospital setting for people who may be agitated or anxious, can be prescribed in that setting. So it's really important for people with PD or their family to make clinicians aware that you have this diagnosis, because that can inform some of your treatment options. And then I also wanted to cover some of the treatment that's available for cognitive changes. As with most mental health conditions, there are general lifestyle activities that are important for your cognitive health throughout your life course. So these are exercise, socialization, and diet. And those are really beneficial no matter who you are. Screening for cognitive impairment is routinely conducted for people who are newly diagnosed with PD, but it also occurs during the course of the disease. So many of you may have done that Montreal Cognitive Assessment, or MOCA, where you have to remember 5 words and do some different activities. And that's something that you might do every year that you go to see your PD doctor. In the figure that I have on this slide, I have some different cognitive approaches that can be helpful at different stages of PD and cognitive impairment. So cognitive training is something that can be helpful really at any stage of the disease. And this involves either a written or computerized task that can target a specific cognitive function. So you might notice some difficulties with attention, and you can look up different tasks that can help you improve your attention. Or if you want to address executive functioning, you can do the same thing. Cognitive rehabilitation is more for people who might be experiencing mild cognitive impairment and dementia. This is an individualized approach that helps people to develop different strategies to maintain their performance and activities of daily living. There's also cognitive stimulation, which involves working in small groups and doing stimulating activities together, which can improve both your cognitive as well as your social functioning. And there's also reminiscence therapy, which is generally used for people who have dementia. And this helps individuals remember events, people, and places from their past. And it uses all of the different sensory modalities. And as with all the previous conditions we've described so far, a combination of medication as well as some of these behavioral strategies is usually recommended for managing cognitive problems in Parkinson's disease. So for the last portion of my talk, I wanted to share some of the information that I learned from my dissertation project, which relates to quality of life in Parkinson's disease. Quality of life is a topic that has been pretty extensively studied in this population. And most of the existing research has focused on identifying factors that are associated with quality of life, which I've included in this figure. So things like depression, mobility limitations, mental health, attitude, and social support are all different factors that can contribute to your quality of life. However, as I was reviewing the literature, I really noticed that something was missing from these existing studies. I thought we really needed to understand a more detailed account of what affects quality of life and methods that can be used to maintain quality of life from the perspectives of people with PD and from their care partner perspectives. So for my dissertation project, I interviewed people with PD and their care partners about what they felt impacted their quality of life the most. And I also asked them about different tools and activities that they've identified as helping them to maintain their quality of life. So for this project, I was able to recruit and interview people with PD and their care partners from the Johns Hopkins Parkinson Foundation Center of Excellence with the help of a neurologist and a psychiatrist. I asked questions to elicit these participants' thoughts about what symptoms impact their quality of life and, like I mentioned before, the activities they engage in to maintain their quality of life. And then I analyzed these transcripts and consulted with a team of clinicians to determine what the key ideas were that came out of these discussions. So here's some demographic characteristics for the people who participated in this study. There were 9 care partners and 10 people with PD who completed these interviews. Most of the people with PD were male, which you probably know is more common for Parkinson's, and most care partners were female. Most of the care partners were also the spouse of the person with PD, although there was one mother and daughter dyad. And I interviewed these individuals either separately, so I interviewed the person with PD and the care partner alone, or in some cases, I interviewed them together, and I really left it up to the participants with what they were most comfortable with. And I do want to highlight that the average disease duration for this group was about 10 years. So the sample does not represent someone who is newly diagnosed, but I still think that this information and the different quotes that I have included from these interviews might still be informative for this group. And one of the things that I think might be interesting is the last column, where I have some of the symptoms that people with PD reported as impacting their quality of life the most. So I think this for me really highlights how different each person's experience with Parkinson's is, and points to the need to really advocate for yourself and have your family advocate for you with clinicians, because there's not really one way to look at PD, and you need to know how you're experiencing it, and it may be different from others. So this figure represents some of the key ideas that arose from this qualitative analysis. And for the purposes of this talk, I'll present findings from the first two themes, because I think those are more relevant for this group. But I have my email at the end of this presentation, and anyone who wants the findings from the other parts, please feel free to reach out, and I'm happy to share those. So over the next few slides, I'm going to go through these different topics and share some examples of quotes that really motivated these key themes. So the first theme really highlighted the different changes that were required of someone with Parkinson's, as well as their care partner, after they were diagnosed. And participants also described the impact that PD had on their quality of life. They reported the problematic PD symptoms that interfered with their quality of life the most. And this was described from both the person with Parkinson's perspective as well as their care partners. And in the table I have on this slide, you can see which symptoms were most frequently reported from each perspective. So I think it's important to see that there's agreement between care partners and people with PD on certain symptoms. So both agreed that cognitive impairment is an issue that impacts quality of life. And they also believed that motor symptoms and social changes impacted quality of life. But there's also some incongruency on other symptoms. So things like anxiety and embarrassment were reported more by people with PD, whereas care partners were more likely to report personality changes and mood changes. So I think these findings really emphasize the previous guidance for detecting mental health conditions. Having family and friends help with monitoring symptoms might be beneficial for you, because they might catch something that you're not recognizing. But then the other case is also true. You need to communicate what you recognize as changing in yourself, because others might not notice it as much. Participants in this study also commented on different changes that occurred within their relationships, so between the care partner and the person with PD after they received the diagnosis. There were several participants who were able to maintain their relationship quality, but there were some who reported that their relationship actually became stronger after being diagnosed. And many attributed this to feeling more open and being able to discuss hard topics together after receiving this diagnosis. Participants also described how their time together changed. So they might do different activities, different from the ones that they maybe performed before their diagnosis. And they also described the importance of this relationship with their care partner for maintaining quality of life. And I'll just give you a little time to review. I have some sample quotes here that I think can really help demonstrate these different ideas that came out of the interviews. So the first one is from a care partner who noticed personality changes with the person they were providing care for. And that person had PD for over 15 years. And then the second quote is from someone with Parkinson's who noticed an improvement in their relationship. And if you want to go back to any of these, I'm happy to at the end. So the second theme really emphasized the methods that people with PD and their care partners used to manage their symptoms and also to maintain their quality of life. Participants identified different coping methods that they used to manage PD. So they included things like exercise, participating in intellectually stimulating activities, and also participating in different groups and socializing. And here I also have some quotes from, sorry, oh, I thought I was going to sneeze. Quotes from people. So this first person described participating in a support group and found that very beneficial for them just to speak with other people who shared their similar experience. And then the second quote is from a care partner who recognized the importance of exercise and found a way to help the person they were providing care for get some exercise every day. And participants also commented on the treatments that they received that helps them manage their PD symptoms and also maintain their quality of life. So they mentioned some medications, both the dopamine replacement therapies they used to manage their overall Parkinson's disease, including motor symptoms. But they also listed some medications for specific symptoms that they found impacted their quality of life. So things like anxiety, depression, and sleep problems. People with Parkinson's also identified different therapies that they found very useful. So these included art therapy, physical therapy, speech therapy, and also counseling for different mental health issues. And again, I have some quotes. The first one is for someone who found relief with an anxiety medication and also had to make some adjustments to behavior. The second quote and the third quote are for different types of therapy that people with PD found to be very effective. So I'll just give a little time again to read through those.
Actually, can you read those aloud?
Oh, yeah,
and go back. Somebody
sorry.
had said that it's a little small on his screen, and these happen to be incredible, so I don't want people to miss out.
Yes, no problem. Maybe I'll go back to if that's wanted at the end. So this first quote, the person said, Xanax, I get anxiety attacks almost every morning. Like around 9 o'clock or 10 o'clock, I'll take a Xanax and then I'll kind of level off. And I can't I can't stand being in crowds anymore. So that person found a medication that worked, but they were also able to recognize that they had to change their behavior and avoid crowds to prevent anxiety attacks. The second quote, I went to therapy and, all kinds. I went through neurofeedback and eventually got back on my feet in a better place. Let's put it that way. So they found some relief and support from neurofeedback. And then the third quote, I've taken speech therapy several times and advanced speech therapy several times. It helps me when the voice becomes halting. So those are all useful for these people that were participating in the study, and they may be beneficial for you as well. And then people also described specific support systems that were beneficial for them. Many indicated that they received support from their family members and friends that were really critical for their quality of life. Some people with Parkinson's reported that they attended support groups or informal meetups with other people who had the disease. And many defined the need for this interaction with someone who either understands what Parkinson's is or is experiencing it themselves as an important part of their coping process. So I'll read some of these quotes as well. The first person says, I mean rock steady. I get there like 20 minutes to 30 minutes early, and some of the other boxers, we shoot the expletive, and that's always nice. I actually go there early just to make sure I can converse with others because they're in the same boat. I think that was a really important quote because that's something that I might not have assumed is needed for someone who's experiencing this disease, but I think it makes sense. We all want to talk to others who are experiencing similar things to us so we don't feel as alone. The second quote, a spouse or significant other is a big part of it. I think, and having someone who understands and appreciates what you are, what you're going through is really reassuring to me. And then the last person shared, definitely have somebody to speak with, someone who is aware of Parkinson's and its effects on the brain. So these people were really all on the same page, maybe going about it in different ways, but they found that interacting with people who understand Parkinson's or are going through it themselves can be really important. And then I also wanted to just give some general wellness strategies that I found in that qualitative study that I just presented, but also that's supported by a lot of evidence in the research. So I think hopefully you've seen that social support is a really critical component for maintaining quality of life and mental health. So seeking out support for your mental health may be looking for a mental health professional, joining a support group, or just talking to your family and friends about different things that are bothering you. It's also really important to practice self-compassion and self-care. I know this can be hard to prioritize, but living with PD can obviously be challenging, and it's really important to take care of your mental and physical health with this disease, but also for the general population. So doing different self-care activities like getting enough sleep, eating a healthy diet, and doing things that you enjoy can be really important. And then the last thing, exercise, I think we've also seen is really impactful for your mental health and quality of life. In fact, the largest ever clinical study of Parkinson's disease shows that exercising just 2.5 hours a week can slow your disease progression and also delay any declines in quality of life. So exercising at any time can be beneficial to you. And even if you have some issues with, keeping to a specific exercise class, you might do things like parking a little farther away to walk further to the store, maybe standing up and marching during a commercial while you're watching TV. Or if you have any issues with balance, you can do stretching activities, or there's chair yoga as well that can be beneficial. And then this is an activity that I found, since we do have some more time, on the Parkinson's Foundation website for people who are newly diagnosed. And I thought it might be helpful to go through these different prompts that I've included on the next few slides to kind of write down some ideas or thoughts about how to start and continue a wellness journey. So if you want to write down your thoughts on a piece of paper, that's fine. You can just think about them. And if you want to share anything in the chat, of course, you can do that if you're comfortable as well. So the first thing is trying to identify some things that are important to you. So if everyone can just take maybe a minute or two to just think about some things that are most important to you. Okay, I see some people have shared too, which is really nice. So that's the same for me. Spending time with friends and family is really important. And I think, thinking about these kind of things and prioritizing them in your life can really help with your quality of life and wellness. And this may change over time, but try to keep checking in with yourself and prioritizing what you find important. And the next question, who is someone that you can talk to? So this might not take as long, but just try to think of someone that you can reach out to discuss PD or just general concerns you may have. It's always important to have someone like that in your life. Okay. And then what is a goal that you can either adopt or try to maintain if you're already doing something that's a healthy habit that can improve your overall health or quality of life? So this could be things like changing your diet, maybe exercising as much as you already are or more, improving your sleep. Just try to think of one thing. Okay, and then I think there's one more. What is an activity or type of exercise that you enjoy doing and that you think you can continue to do for the near future? And this, of course, can change over time as well. Okay. Hopefully that gave you some time to consider some of these questions. Like I mentioned before, I'll be posting these slides, so you can always look at them later and help you think through some different wellness approaches. And here I have my email, so you can feel free to reach out if you have any questions about today's talk, or I can share some of the resources that I presented today as well. And maybe I'll stop sharing. I don't know if there are any questions that came up. Oh, thanks, Kelly.
Kelly is quick.
Yeah.
We did put some things in the chat, so I do encourage everybody to save their chat. And you can do that by, if your chat is open, there's 3 little dots on the bottom. You can go ahead and click on those and click on Save Chat. We do have some questions, and so I want to get down into those. One person asked, as you talked about testing the level of apathy, and he had never heard this before. He asked, what kind of tests determine the apathy level?
I don't know if maybe I misspoke. I wouldn't consider it a level of apathy, but there are just questionnaires that you complete to determine if you might have apathy. And like I mentioned, generally a clinician will rule out depression, which some of the symptoms overlap with, or other things that might cause apathy before they give you that diagnosis. So I apologize if I said level of apathy.
Somebody asked, and I feel like you kind of touched on it, but not exactly. For depression, what about microdosing with like psilocybins or other such chemicals? Those are mushrooms or like psychedelic drugs. And I'm thinking, I don't think that would be a good thing with the Parkinson's disease.
You know, there is actually new research in that area. I am not an expert by any means in that area, but there's a center at Johns Hopkins that's opened up recently. I don't know if they're focusing on Parkinson's specifically, but I know for depression in general, they're looking into that and it can be effective. So I guess I would say I'm not an expert, but it seems like it's a growing field. So hopefully we'll know more soon.
One of the quotes that you had read, the first one, I really felt like that just dealt with ambiguous loss that I kind of wanted to explore a little bit more because it talked about from the care partner that this person isn't himself anymore and he doesn't realize it. And so I really do like to talk about ambiguous loss and how it affects both the care partner and the person with Parkinson's. You know, just what is it and, you know, why it can be such a difficult thing.
Yeah, and maybe I'll bring that up again. Sorry that it was too hard to see for some people.
You actually did read that one. So
yeah.
You did get
I did read it?
Yeah, you did read that one.
Oh, okay. Well, I'll pull it up again. So this was a care partner who had been providing care for their husband, I believe, for more than 15 years. And they, similar with, you know, what most people experience with ambiguous loss, the person is still there, but they're different. So I think it's not unique to Parkinson's, but many people who are diagnosed with a condition that can change their behavior or personality may experience this ambiguous loss where they're losing maybe or having changes in a part of their normal self. And I think it can be helpful to communicate this and get mental health support. This care partner was able to find some support to help deal with this, but it's important to talk about so that you don't feel like you're alone in this experience.
Also, they did talk about support groups, and a few people in the chat talked about how much rock steady boxing has meant, or, you know, and I do encourage people, especially if you think, well, I don't really want to go to a support group. That's the cool thing about the exercise groups is often they become support groups, even though that is not their initial intention, but you become friends with them. And it, you know, based on your research, it really seemed to show that people get a lot out of that.
Yes. And something else that I noticed in the interviews that I did was that some people had to kind of shop around for different support groups. So the first one you go to might not be the right fit. Maybe you don't share the same experiences with other people in that group. So you can try out different groups. There are some that are online even now to see which group you click with and which group you might benefit more from. So don't stop at the first one if you think it's something that's important to you.
One thing you did talk about with some of the cognitive impairments. Has there been research about what is Parkinson's disease and what is just normal aging? Because I think a lot of us have the tip on the, you know, like, oh, I forgot that word, or you walk into a room and you're like, why did I come into this room again? And, you know, do we actually know like how much is Parkinson's and how much really is just a part of normal aging? I used to work with this nurse practitioner after I had my second baby, and I was like, I'm in my 30s and I'm like forgetting stuff. And I remember she said, it's not a problem if you forget where you put your car keys. It's a problem if you forget how to drive the car. And so like I joke, I'm like, this has like been gospel for me for many years. And I'm like, Terry said, it's not a problem if, and somebody joked about senior moments. What do we know about that? What's Parkinson's and what's just kind of senior moments, if you will?
Yeah, I think that's really hard to distinguish, obviously, because generally people get Parkinson's as they're aging. So it can be hard to distinguish what is PD versus normal aging. I think there are different domains that might be more affected in Parkinson's. So generally executive functioning. So switching between different tasks is more impacted for people with PD. But there's also other areas that can be impacted as well. So I don't have a really great answer for that because I think they're still learning, you know, what's causing cognitive changes in people with Parkinson's. But I think generally there's more cognitive impairment than you would expect at different age groups.
About the delusions, and I know that's often a big issue for care partners because, you know, how do you prove I'm not trying to poison you? How do you prove? And you said, like, you can't just say to a person, oh, that's not what's happened. Do you have suggestions or tips, or, you know, how to deal with this? And
I think for delusions especially, it's incredibly important to get help from a mental health professional because they can work through more of a formal plan and discuss different challenges that can arise with that type of a diagnosis. Unfortunately, I think patience is probably the biggest key to dealing with delusions because you can't talk someone out of their belief. They believe it firmly and it's caused by these changes in the brain. So recognizing that it's not the person might be helpful, but getting mental health treatment is the most important.
one thing you did kind of also talk about, and I always like to stress this, is that depression seems to be a part of Parkinson's. And I always just want to, like, this is not a character flaw, you know, and like we would never say to somebody with diabetes, well, you just need to think happy thoughts about insulin and everything will be fine. And or we don't say, you know, what's wrong with you that your pancreas just doesn't, you know, produce the glucose, you know, do it properly. And so I just feel like I would never want anyone to be uncomfortable. Like I do want people to talk about their, you know, anxiety and depression and understand it's okay. Like you were very just like, yeah, it happens. It's, you know, seems to be kind of part and parcel with that, that this is not something like you're not surprised by it if somebody comes to you with depression.
Exactly. And I think hopefully what I've presented really shows how it is a part of the disease process for many people. And it's not like it's something you're causing in yourself, but it is something that you can treat and find significant improvements in your overall quality of life and functioning if it's successful. So it's worth talking about because that will help you to get support faster and hopefully address those symptoms.
There were some comments in the chat, and we do want to remind, because again, obviously we heavily advocate support groups. You might have to shop around, if you will. Just because the support group is closest to you doesn't mean you're going to click with those folks, you know, and you want to feel welcome and you want, you know, to be included. I personally advocate for them because I feel like it's nice to know someone else is going through what you're going through. And, you know, again, like with those quotes, that someone was feeling very understood when they were in the support group. And I just think that, you know, yes, if you've met one person with Parkinson's, you've met one person with Parkinson's, and not everyone has had the same, but there are some similarities. And I just think it can be very refreshing when you know someone knows exactly what you're talking about because they deal with it too.
Mm-hmm. Yeah, I 100% agree with that. And hopefully you will be able to find a support group that works for you if that's something that you think will be helpful.
Does anyone have any other questions? Because I can ask questions all day, but if anybody has any other questions or whatnot, I'd love to ask your questions. You can find groups if you go to pmdalliance.org on the resources tab. You can find groups. Kelly actually also put that link in the chat. Our list is not finite, but we definitely also encourage you to call around to the areas. Again, we just really want people to join a group and have that support. And so, someone talked about Rocksteady boxing, but also really likes ballroom dancing. So yeah, that's wonderful. People are talking about support groups, and that's support groups are also a wonderful way to get resources. Someone saying that's how he found the Parkinson's disease trained therapists. And again, that's just wonderful.
Yeah, that's great that you're doing ballroom dancing. I think that's such a cool way to get exercise. And yeah, like this person said, cognitive and social abilities are improved as well. So it's nice to find those activities that work on multiple areas of our lives.
What about, because you talked about anxiety. I know a lot of folks that have anxiety because of freezing. And they're like, you know, what if I'm out and I just freeze? What happens? And, you know, that's, to me, I always felt like that was hard because most of our fears are founded on irrational thoughts, but this is actually kind of rational that it's like, oh, yes, that could happen. So how do you talk to people about that?
Yeah, I think I've noticed some people who have had success with different devices or tricks that they can use to get over freezing. So I know one is trying to think about stepping over something, and that can help you overcome that freezing episode. They have assistive devices like this laser on a walker that can also help kind of trigger your brain to get over that freezing episode. But yeah, that, I mean, obviously that's a very reasonable fear because that can lead to falling. So it's important to address.
I did have a question. What's actually very interesting to me is that the nurse practitioner I used to work with, she always said that she didn't think it was that big of a deal, but it was a sexy story. So it got a lot of traction, was how the dopamine agonists are linked to addictive behaviors like gambling or shopping or and so he was, the question was, do you think that is linked to Parkinson's disease or a direct result of the dopamine agonists?
I think there's evidence that supports it's kind of both. So it is part of the disease, but I think it can be exacerbated by these medications. And a lot of times people will have to go on to some other type of treatment if they are exhibiting these impulse control disorders to see if that helps with those behaviors. But I know that is another area that's growing, another field of research that's growing. So hopefully we'll understand a little bit more about what specifically happens there. But you're right, it doesn't happen for a huge percentage of people with PD, but it's obviously a behavior that can really affect your life. So it's important to seek out help for that as well.
You talked about on the care team, how would you know when you needed a neuropsychologist, for example, versus just a regular psychologist or a neuropsychiatrist? How would you know, or would you say, given the Parkinson's, you would always kind of go for a neuropsychologist, or if you could, how would you differentiate that?
Yeah, I think I wanted to list those options because that's kind of the comprehensive list of people. I know neuropsychologists, I guess if you have that available to you, it might be the best option because they do have that additional training in diseases like Parkinson's. But there are psychiatrists who are very informed as well, and you can get just as much effect from them as you would a neuropsychiatrist. For neuropsychologists, those people are generally used for neuropsychological testing, which some people may have already done, where you get really a comprehensive list of cognitive tests, and they can see if you have any impairment in those different cognitive domains that I presented earlier. So that's a specialty that's pretty separate from regular psychologists that offer more of the psychotherapy.
Question about neuroclinical specialists.
Neuroclinical specialists. I'm not familiar with that.
It's apparently it's a licensed physical therapist.
Oh, okay.
So yeah, no, I just looked that up, Roger. Yeah, that's a different specialty, Roger.
You taught me something new.
I was Googling it and I was coming up with neonatal care. And so I'm like, that's not right. And then he explained it a little bit more.
Oh, great. Okay.
Well, thank you so much for your time today, Dr. Perepezko. This was incredible. I just really appreciate you coming and talking to us. This will be available tomorrow. And as we said, Dr. Perepezko is also going to provide her slides so people can go over those. They were extremely informative. So we're so grateful. Somebody did also just say to me about saving the chat. To save your chat, there's the smiley face, that's how you add an emoji, and next to it are 3 little dots. And if you hover over this, more will appear, and that is how you save your chat. So, because we did put a few links into the chat, so I do hope you save it. We have a tradition here at PMD Alliance, our wave of gratitude. Thank you so much for your time today. You gave us so much great information. I'm so happy that you joined us. Thank you.
Oh, great. Thank you everyone for attending the session today and participating. I always find these very informative for myself as well. So thanks and keep learning, everyone.